Well, what is the best emergency temporary material? In comes a patient. My filling fell out. Yeah, it sure did. What are you going to stick in there? You got 20 patients. They're hammering on the walls. They're complaining about their dentures, and you got this person with a filling out. Well, IRM was invented right at the beginning of the Vietnam War. I was involved with it. As we were getting soldiers ready to go over and get shot, we would put different colored IRM in. What's good about it? It's strong. It's relatively easy to use. You can mix it thick or thin. It's eugenol based, so what's it doing? It's obtunding the tooth and therefore calming it, even if there might be a minor pulp exposure. This will often calm it down, at least for a time, until subsequent treatment could be done. So IRM should be in everybody's armamentarium. There are other similar products, but this one leads in its popularity by far. Well, what about the old, ugly stainless steel crown? Now, where they are in that particular mouth makes no difference. Nobody's looking back there anyway. But only some mothers will accept that in their child. Some do not want the display of metal, and that leads you on to the use of zirconia prefabricated crowns, where you basically fit the tooth to the crown. Here you fit the crown with the stainless steel, you fit the crown to the tooth. You crimp the margins, bend them over, pop it down over the tooth with IRM or something underneath, and you have a reasonable intermediate term restoration. Not bad. Stainless steel crowns do not wear down as you might expect other temporaries to. The stainless steel crown that is most popular is the one we were just looking at, 3M. However, there's one for a lot less money that we tested that you might want to look at if you're in the stainless steel crown marketplace and you want to use it as kind of a semi-long term. Maybe you've got a few months to get out of it. These are low cost compared to the premium brand from 3M. 3M's been around a long time. I'm not negating that at all, but this is an alternative if you want to use it as an immediate temporary. Well, what about these aluminum shell crowns? Wow. Try to find something uglier. They're flat top. They're very malleable. You could take any one of those and crush them right between your two fingers. Can't do that with the stainless steel one. But on an intermediate basis, somebody came in, the crown fell off, they've lost it, and you're right in a milieu of patients trying to get through the day. This, assuming it's a posterior tooth cemented with ZOE, particularly IRM, would be great for that interim time so you could get them back in. Aluminum shell crowns have been around forever. Early in my career, that's all we had. Other than trying to do some polymethyl methacrylate material, which was stinky, hard to use, and potentially now known to be dangerous to kidneys and liver. So these are still good. Very inexpensive, pennies. Take a look at that if you're not using them now. They are ancient materials. And then there are a lot of these that are either a resin shell or a celluloid or mylar shell into which you place resin, put it down over the top of the tooth, and with the clear ones, you can even peel that off if you desire to do so, and leave just the composite, which is slick and smooth because of the inside of that crown forming the smoothness on it. So these are excellent temporaries for the example I put there, where it's a premolar, there's a prep there, and you want something on there that looks like a tooth. Maybe the crown has just come off. However, you can't get that off without cutting it off, so be very aware of that. We're all faced with a so-called emergency. It's hardly an emergency. It's just a time-consumptive thing right on the top of your schedule. Actually, when I was really thumping in practice many years ago, I'm part-time now, we had a little operatory that was just for this kind of thing. Stick them down in there, plug something on, we'll get them back in a few days. So these are the kinds of things that are imperative in a busy, ongoing practice. Use them. Thanks for being with us. Join us next week.